Good morning. This is my mom. She's sick.
Needs to see a doctor.
Mrs. Nguyen, how many times have you been pregnant? Have you had any miscarriages or terminations?
Oh, really? I'm sure it was just 5 pregnancies.
If you don't mind, we really need to know.
Ông hỏi mẹ có phá thai, nạo thai lần nào không? Con nói là không.
Thì đúng rồi. Đương nhiên là không có rồi.
She said no.
It is the doctor's duty to inform the patient of any condition they are suffering from. However, family members often do filter the information. This patient had a number of terminations, but was reluctant to reveal this in the daughter's presence. The daughter was reluctant to interpret the test for cancer. In these situations, medical professionals never know what vital information they and the patient are missing out on.
We have a 37-year-old pregnant woman for a booking in. Have you interpreted for one of those before?
Oh yes, many times.
I think that communication flows best when doctors and the patients speak naturally, talking to each other directly while being aware of the interpreter's presence.
Shana, I'm going to ask you some general questions. Are you married?
莎娜，我要问您一些一般性的问题。您结婚了吗？
是的，那个在前台的怪人就是我老公。
Yes, that grumpy man in reception is my husband.
Sit facing the patient and speak directly to them. Maintain eye contact and give non-verbal reassurance.
Hello, Dr. Roberts speaking.
Hi, I'm Katitsa.
I will be interpreting for you today.
Hello, Katitsa. I'd like you to interpret for Mrs. Horvath here. We've performed an angiogram on her today, and I'm about to give the results.
Da li je potrebna operacija? Does that mean that I need surgery?
Yes, I'm coming to that. Please be calm. I'll tell you what we're proposing to do.
Da, sad ćemo o tome. Samo se smirite. Objasnit ću vam što namjeravamo napraviti.
Pokušat ću.
Try.
A clot like this could ultimately cause death, so we need to perform an artery bypass.
Ovaj ugrušak krvi bi u krajnjem slučaju mogao uzrokovati smrt.
Da bismo to spriječili, trebamo napraviti operaciju
Kako mi možete reći da se smirim, a sad ste mi rekli da mogu umrijeti?
During phone interviews, healthcare providers should use a speaker telephone or a dual handset and sit close to the microphone. They should sit facing the patient and maintain eye contact. They should speak directly to the patient as you would in a face-to-face interview, and pause frequently to allow information to be taken in by the interpreter and passed on to the patient.
Por lo menos no me van a tener que llevar a ese nursing home que dicen ustedes.
We're meeting here today to discuss the care options for Mrs. Perez when she's discharged from the hospital.
When patients' family members or multiple healthcare professionals are present, interpreting becomes more complex.
There is a bed available in a Spanish-speaking home. It is available this week, and these sort of opportunities do not come up that often.
Señora Perez,
I'm totally against that. Can we just slow down?
I love my mother.
Excuse me. Just one at a time, please. Can we just slow down?
Typically, in these settings, the English-speaking participants talk directly to each other, excluding the patient from the discussion and decision-making.
We have a friend that went to a nursing home. ¿Te acordás de Susana, mamá? Está muy contenta.
Claro, ¿cómo no va a ser contenta si no sabe ni dónde está? Por favor, Catalina, no me...
In family conferences, healthcare providers need to set the rules of participation that allow the interpreter to keep up and ensure only one person speaks at a time.